Hi. Are you someone who has suffered from facial paralysis and is finding that your cheeks have become asymmetrical? Do you feel that the affected side of the face is falling down and drooped, the lips are also falling down compared to the normal side? Then in this video, I'm going to tell you why that is happening and how you can fix it. Let's get started. Friends, when you get facial paralysis, the muscles of your face, which are responsible for your facial expression, gets paralyzed. These muscles are muscles around your cheeks as well. And that's why when you get facial paralysis, due to the paralysis, these facial muscles will drop down. And that will make your face look droopy. Now, there are certain factors that lead to higher chance of delayed recovery or else more time being taken for these movements to come back. These chances could be, number one, the medications were not taken on the right time. Number two, the kind of paralysis that you got itself was very severe. Number three, your immune system was very low or else your healing time is slow, due to which you are not recovering in the timeline that is usual or considered normal. In all of these three scenarios, you will observe that getting back the movement around the mouth will be very difficult or else it takes more time. The reason is simple, because the nerve that supplies the muscles around the face, around the mouth and the cheeks is one of the longest branch, and the longest branch takes more time to recover. Now, that's not all. Along with this, as you are aging, your muscles will be more tight and shorter. The collagen level in your skin will be less. The ligaments will be more lax. Even the jaw muscles will be more tensed, and the bones alignment and the size will also shrink. These all factors also contribute to your face looking more drooped compared to a younger person who developed facial paralysis. So how you can fix this problem? The first thing that I would like to tell here is that correcting a facial asymmetry is a process, it's not a procedure. Many a times people come to me or come to us for a consultation expecting that in one consultation we will teach them some magical exercises, and doing that magical exercises their facial symmetry will come back. Unfortunately, it never happens that way. Every facial paralysis case is different. We need to assess them, and based on the particular condition, which muscles are more involved, which muscles are less involved, which muscles are more tight, which muscles are less tight. Depending on all of them only, we can determine and create a customized exercise program or plan which needs to be practiced for a very long period of time. In fact, there is a need of change in exercises on a periodic level as well. That's why please remember and understand this, that there is no one magic exercise or couple of magic exercise that if you will do that and automatically your movements come back. It will never happen. You need to go through a proper rehabilitation process if you want to work on your facial asymmetry. However, there are some practices that you can start immediately to correct your facial asymmetry. Let's understand what are those. So, your facial asymmetry is happening due to the droop of your facial muscles, especially your smile muscle, which is called as your zygomaticus muscle, which moves out from its original position and falls down. At the same time, the fall of the depressor muscle, which is the muscle which is responsible for your downward movement, that also falls. And this is being pulled by your neck muscles, which is called as platysma muscle, which is also paralyzed in facial paralysis. So, if your platysma is pulling, falling, it will have an impact on your cheek muscles and will make your face look more asymmetrical, more droopy. In order to correct this, there are three most important things that you need to do. Number one is to focus on correcting your posture. Your posture play a very critical role when it comes to your facial symmetry. If you have a forward neck posture, there's going to be a lot of pressure and pull that your face will experience due to this elongation of your platysma muscle, making your face pulled further down. Along with that, when you will have facial paralysis, your lymphatic system or your blood flow will be limited. Due to that limited blood flow, your facial muscles will not have enough fluid movement, which will make stagnant places in the face, limiting the movement of your facial muscles. And the third thing that will happen is, as your Bell's palsy or facial paralysis keeps on getting older and older, muscles will start getting shrinked or shortened. And these shortened muscles do not move freely. So, if we want to correct all of these three things, we need to work on three things. Number one is your posture correction. And that's why in all of our sessions that we do for facial rehabilitation, we ensure that we add posture correction exercises, especially around the shoulder and neck region. That's the most critical aspect that we need to address. Number two is doing lymphatic drainage massage. Lymph nodes should be empty to allow the free flow of the fluid. If that's not happening, then it's very difficult for these fluids to move, which will not allow the space to be developed for these facial muscles to move. And number three is to make sure flexibility of these facial muscles, and this can be achieved with the help of facial massages. You heard me right. Facial massages in the form of myofascial release, deep tissue massages are something that helps. These are all advanced techniques that we use while helping a patient suffering from facial paralysis. So if you think that exercises, yes, exercises are important, are very important and are very effective, but it has to be done at the right time, at the right quantity. No exercise should be done in the phase where your facial muscles are overstrained. That will make things difficult for you. So please, if you want to start doing any of the exercises for your facial muscles, or if you want to work on your facial asymmetry, take help of a physiotherapist, get yourself evaluated, and then only start. Please remember, you are suffering from a condition which is called as facial paralysis. It's not like a regular thing where you can just follow any kind of random massage and just leave it. It will not work that way. I hope this video gives you some clarity. The idea is not to scare you, but make you understand that how important are these minute details to be kept in mind when you are working on your facial recovery. On that note, I'll end this video here and I'll see you in another video. Thank you.